I think it was a very, very important platform to connect with people who are forward thinking, who are looking for technology to solve the issues of healthcare in our country. And also looking at all those specific platforms where you think innovations can disrupt what is going on and change the status quo. And that is why this platform was very, very important. See, disruption is the buzzword that we talk about a lot, and I think until unless we adopt technology, I think this disruption in healthcare is not going to happen. As per what Dr. Devi Shetty talks about, and he says that affordable healthcare to the masses, and as I also said in my today's panel discussion, that we need to democratize healthcare, where a person's economic standard does not determine the healthcare he or she gets. I think if we have to go towards that goal, we have to look at how we are able to transform technologies like mining of data and using it to predict models to go into the masses, so that where doctors are not available to those platforms. We need to also look at a touchless healthcare, especially in areas like ICU, etc. And many of our doctors in Narayana Health actually do that. We also need to look at predictive healthcare, and most of all, very importantly, we need to build a trust of the people in technology, because unless people have trust in technology, technology is not going anywhere. Yes, so I think the most important challenge is that right now the electronic medical records, that is a benchmark, or I would say the fountainhead of everything that happens in platforms like AI. We are nowhere there. So many of us do not have the EMRs of patients. So we need to move on that journey of building a huge amount of EMRs correctly. And the second and the most important point that I reiterate again and again is that people need to start having trust in technology. And the day the technology is seen as something that patients and attendants have a trust in, I think it will be a win-win model. See, India, the problem of healthcare is very, very simple. We have huge capacities in private healthcare, but we have huge number of patients in public healthcare. So interoperability means sort of a bridge between the government and the private healthcare, and also between the private healthcare players. So intra and inter-private healthcare, and also between the government and the private healthcare. And once we are able to bridge that, huge amount of capacities versus huge amount of patients, I think we'll be doing a good amount of work in solving this healthcare problem of our country. The trends are going to be, I think, a mobile phone is going to be a big disruptor in everything that you see, and wearables we have many of these watches who give a lot of predictive analysis. In my view, the two big trends are going to be how we predict disease pattern, how we predict the treatment across the patients, and also we are seeing this coronavirus thing going on in the world, and one big thing which is being talked about is we don't touch neither your face nor each other and keep away. I think touchless treatment, especially in critical care areas, and how we solve the problem with technology is going to be very, very important.